Hi, welcome to the presentation on the concussion in an NAI football player who was recently tackled to the ground during his last home game. This particular athlete is a 21-year-old tight end, NAI football player. He has recently, in past years, had a sesamoid fracture that he repaired through surgery, still does treatment on it whenever it's bothering him, and has to wear a brace for every practice and game for his UCL on his elbow, which we believe is 85% of a tear. He's planning on getting a surgery for it at the end of the season since he is a senior this year, and he will be able to have a full recovery time for it without having to worry about getting back into the game. And he's only had one concussion before that he had received in high school. Took him about a week to return to play after that one. This injury that we are talking about today in this presentation is about his concussion that he received in the last home game. He was hit and fell to the ground. It was not a helmet-to-helmet contact. There was no contact with his head, but his head had done a whiplash kind of movement, and when he was hit, it bounced from side to side, and then when he hit the ground, it bounced again a couple more times. So we believe, after viewing that footage on the film, we believe that is the hit that caused him to receive this concussion. After he fell to the ground, he came off onto the sideline, didn't tell any athletic trainer about the hit. He felt he had just got the wind knocked out of him, shook it off, and went back out and played the rest of the game a few plays after that hit. A couple days later, that game was on a Saturday, he reported that he was having trouble falling asleep, and he was having headaches and dizziness, and just wasn't feeling normal on that Monday after the game during practice. So we did a sideline SCAT-5 evaluation on him, and we saw that his balance was fine, his memory was fine, his focus and attention was a little off, but he was able to recall the words, repeat the numbers backwards. But when we came back inside, his symptoms were extremely high. We're talking about 4s out of 6s on all of them, basically. So from that, we diagnosed him with a concussion and pulled him from practice and games. This athlete is still experiencing symptoms. He has not been able to start the return to play protocol just yet. He's been instructed to not practice or participate in any physical activity, including football, workouts, weightlifting, running, conditioning, anything like that. He's also had some trouble with schoolwork and taking exams and things like that, so we've had to do some academic accommodations for him. We've let his professors know that he has been diagnosed with a concussion, which will allow him to get a little more time with his assignments or exams, to kind of push things back just so he can perform at his highest ability when he is capable of it. Obviously, when you have concussion, you can't focus, you can't think, especially for this type of trajectory, which I'll explain in the next few slides, what kind of trajectory he has. But for the future plans, he's going to continue to document his symptoms, and until he is symptom-free, he will then start the return to play protocol, which is 5 days with the 5 different phases. But that is only after 24 hours of being completely symptom-free. And then that is when he can start. There are several trajectories that could be the underlying cause of concussion, and for this particular case, the athlete has suffered from anxiety and mood trajectory. The risk factors include depression, anxiety, mood changes, family history of any mental health problems or mental illnesses, and it can often be seen in high school girls or even type A students. And this athlete does have depression, anxiety disorder. He takes medications for it, and he's a very smart kid. He's a math major, He knows what he does. He does his homework all the time. He attends classes. So this kind of fits him perfectly. And on the next slide, we'll find out a little bit more about the evaluation that can also show why this trajectory would fit this particular athlete. So the symptoms of the anxiety mood trajectory for this concussion will kind of show that impact test maybe look very normal. At this particular school, we do not have impact testing available to us, but if we had, it could show that it would be completely normal. And the bombs may look very normal as well, so his balance, his memory, his reaction times, all those things that we saw when we did the sideline scat 5, when those looked completely normal, it kind of fits in with this trajectory, because that's not kind of the side of his brain that's being affected by this concussion. It's more about the symptoms that he's feeling because of the depression and anxiety that he has going on already. And when you're asking about the symptoms, you don't want to just ask the typical ones that are written down on the paper. You want to ask more, are you worried? And just how's school going? How is getting your schoolwork done? Are you having trouble with that? What about falling asleep at night and kind of just shutting your mind off? Are you able to stop thinking a little bit, or is your mind just constantly running? And your social life, how is that? Are you getting out of the house? Do you leave? Do you go and hang out with your friends, or do you just kind of stay cooped up in your room all day long? And then are you also having something that you may not be able to figure out? Are you having something that's stopping you from doing certain activities, whether it be just exercising, going to the gym, going to practice, or just going outside of the house? And now that he is kind of going through this recovery period, he is missing some school assignments and classes and stuff. So how is he feeling about that? Does it stress him out even more? Does it cause symptoms to increase? These are the kind of questions you got to ask when it comes to this trajectory, just because of how different it is from all the other ones. So the recovery for this type of concussion trajectory would just be behavioral management. So helping them sleep a little bit better, helping them shut their mind off, stop thinking as much when they're trying to get some sleep, because sleep is one of the most important things when it comes to the healing process. Also giving them a schedule, just telling them when they should be sleeping, when they need to do homework, when they need to go practice or take a walk or whatever it is. Just give them a scheduled time so they can have the whole day planned out. Psychotherapy as well, choose to express their mood changes following this concussion during the recovery period. It can take a big toll on them, especially because they already have so many things going on in their head to begin with, so adding a concussion to it can just stress them out even more. And if none of those things work, you can always go to the pharmacological side aspect of it. So you can go and see a psychiatrist if they need to. Primary care, sports medicine doctors, just to help them figure out what they need to do so their recovery time goes by easier and even faster. And if none of those work, last resort is medication. Always medication. You can help out. Best not to, just because you don't want to have any of those side effects or just lasting effects from it, or possible addiction to it as well. And with these kind of athletes that have this trajectory of the anxiety and mood, they have to be active. That's part of their type A. That's part of their routine. It's part of their scheduled day. So having them just go take a walk while they're studying, or just take a few laps around the field or something like that, just get them outside, moving a little bit instead of staying cooped up in their room all day, is very important for their recovery period. The return to play for this particular athlete, since he has not yet completed a scat form of 0 symptoms, he still is showing symptoms for this concussion, so he has not started return to play protocol just as yet. But when he does, the first phase of it will be when he shows no symptoms at all, marks all 0, signs off on the sheet, and he will then perform a light aerobic exercise for just 15 minutes, whether it be just jogging around the field or on a stationary bike, and then he'll report any symptoms or feelings that he has during those 15 minutes, and then again afterwards he'll be checked to see if he's had any more symptoms arise. And if throughout those 15 minutes and then the rest of the day he had no symptoms at all, he will move on to phase 2 the next day. Phase 2 will be sprint and light weightlifting workout for him to perform. And then same thing, he'll report any symptoms he feels that arise or anything like that. And then if he continues to have no symptoms at all, he'll move on to phase 3 the next day. The athlete for phase 3 will then participate in practice with non-contact drills. He'll be wearing a helmet only. So any team practices or team drills that they will be doing, he will not be participating in, but any individual ones he can, as long as it's non-contact. And then again, ask about symptoms. If there still is none, the next day he will then do full contact practice wearing full pads. This is kind of the last phase for activity-wise to see if any symptoms arise. He will then again be asked at the end of the day if anything is increasing, if he's gotten a headache, a dizziness, nausea, anything like that. And then phase 5, he will be seen by the team physician to be completely cleared that he is free of concussion. It can return back to practice and games with no limits. So this is kind of a 5-day return to play protocol that is being issued with this one. Since this athlete is still showing symptoms of a concussion, he has not started it, like I said before, but I think that this athlete in particular will be cleared of symptoms in the next 2 days. It's been a week now since the onset of the concussion. So I believe in the next few days he will start up having no symptoms, and then he'll start the first phase of return to play. And I don't think he will be showing any signs or symptoms of concussion while he's doing these activities during these phases. And I think he'll be able to participate in the next game, even though there is a bye week next weekend. But I think the next game he will be able to participate in. He'll be fully cleared of symptoms.